Hello, my name is Nga. I'm the health team leader at WCS Viet Nam program. We're based in Hanoi. I'm a veterinarian by training. I have worked for WCS since 2011 and I'm focused on the wildlife health team activity, which we have worked on detecting zoonotic viruses with pandemic potential at points where humans have contact with wildlife. These are the high-risk interface of zoonotic disease transmission and spillover of viruses from wildlife to human and their livestock. In the past 10 years, we have collaborated with different Vietnamese government agencies within the environment, animal health, and public health sectors to understand the threat of emerging pandemic disease facilitated by the interaction of wildlife, domestic animals, and humans. We focus on investigating and understanding the potential transmission of viruses between wildlife, livestock, and human at the key interface along the wildlife value chain, including wildlife farm, wildlife trade, live animal markets, and backwater collection sites. We designed surveillance study to detect the viruses in wildlife as well as human and livestock that come into contact with wildlife at the wildlife farm, backwater collection, and rodent trade route. The samples were collected from both wildlife and human, along with the interview with the people who has contact with wildlife through their daily work, such as collecting backwater, working at wildlife farms, and trapping, slaughtering the rodent and rats. The sample collected from wildlife and human have been tested to detect the viruses at the family level from viral families which cause the zoonotic disease or emerging infectious disease that have occurred before, like the coronavirus family that caused the SARS-CoV and now is COVID-19, and the filovirus family that caused the Ebola, and the paramyxovirus family that caused the measles. In Vietnam, 46 viruses were detected, including 20 known and 26 novel viruses. They are under different viral family and collected from multiple species of wild animals. In addition, we conduct the qualitative research with the ethnographic interviews and focus group discussion with the people who are working at the wildlife farms. From this activity, we found that the animal through many types of transportation as motorbike, car, and trucks, and by different methods, including online and offline. The animal arrive to the farm from multiple places, and after that, they have been sold to many other areas, even export. So, the wildlife supply chain, including both legal and illegal, provide the ideal conditions for the creation, emergence, and transmission of zoonotic pathogen of pandemic potential. As an example of the risk, evidence from Vietnam have been published recently in the +1 about the coronavirus detected along the wildlife supply chain for human consumption in Vietnam from 2013 to 2014. The last percentage of the coronavirus were detected in bats and rodents at the sites where the people has the close contact and interact with the wildlife, including different points along the wildlife trade chain, wildlife farm, and the bat routes, where the bat guano collect to use as fertilizers. The publication suggests that the wildlife moves along the wildlife supply chain from the capture site to large markets to the restaurant. The prevalence and diversity of coronavirus grows, highlighting the increasing the risk of the pathogen transmission and novel viral emerge along the wildlife trade chain.